on to the next thing, which is fluid drainage catheters. Basically, every dermatologist does something called as IND. It is the incision and drainage. The physician makes a surgical cut and then he drains out the products of suppuration like abscess. Fine. Okay. If the physician is going to do a percutaneous drainage just by placing a catheter, we have separate codes. Again, being surgery coders, you need to know one common thing, which is like, what exactly is a method? Is the method employed by the physician is an open procedure? Open meaning cut. There should be a surgical incision. A cut needs to be made into the skin or the subcutaneous tissue. That qualifies as an incision. Otherwise, or if the physician simply passing a needle, which is percutaneous. Okay. So based on these, our codes differ. Now, as I said, the coding is based on the condition. So now comes to the commonest dermatological conditions like abscess, 160, 161. The codes that you need to give is like for any like a carbuncle or for any abscess or pus, it's like you'll have to go for 160 and 161. The codes again are classified whether it is simple or complicated. Here, why do we have separate codes? It's like we need to give credit for the provider's work actually. If the provider is going to drain an abscess which is multi-loculated, it has various loculations, or if he's going to do a technique like marsupialization. What is marsupialization? Do you know a marsupial? What is that? A kangaroo. A kangaroo is within there, it's the young one is within a pouch of the kangaroo, right? So the physician creates a pouch so that even if the cyst or that particular mass is going to form future products of suppuration, it can be automatically drained out. So if the physician employs such techniques, you will have to report it as a complicated or a complex incision and drainage.